Are you a female who is aged between 40 to 55 years? I'm sure at least once you would have found difficulty in having intercourse. So as we age as a female, post 40, your around menopausal age group starts. That is perimenopausal, menopausal and postmenopausal. This is a very important phase of life in a female. So once that perimenopausal age group starts, that means your body levels of estrogen content reduces. Estrogen is a very important hormone for a female. So once that perimenopausal age group or estrogen levels declines, there are a lot of changes happening in the body. So that changes also hits vagina as a prime organ. So because of these changes, what happens around the vagina is the blood supply or the neural supply, that is neurovascular supply, reduces. And also, as you know, collagen is an important integral part of the body. Collagen level also decreases. So once the collagen level decreases, neurovascular supply decreases, the vagina becomes less elastic and also the supply to the glands reduces. So the lubrication to the vagina reduces. So whenever a sexual act is attempted, the lubrication which the glands is naturally supposed to give reduces. Tissue elasticity reduces. So there will be vaginal dryness, burning sensation and reduced lubrication and also painful intercourse because of all these reasons. And another concern in this age group is also because of the post-childbirth. As such, tissue will be too lax, that is vaginal laxity will also be present. So these are the complaints what we come across in this age group, and these are the concerns which as a female she will be underconfident or she's not finding it confident enough that she's satisfying her partner. So sexual life is always couple related. So it's always female and a male who is in the act. So it's always important to address both of their likes, dislikes and comfortableness. So whenever you have such complaints, it's always better that you don't keep it to yourself, don't suffer. You always discuss with your concerned gynecologist and open up about these complaints, because this is actually a serious medical condition and also there are very much advanced treatments available for it. So we usually commonly suggest with such kind of problems, we suggest always a non-surgical treatment options. We do have regenerative therapies and laser therapies. So regenerative therapies is mainly with the PRP exosomes. And then you have lasers, which is different kinds of lasers available, that is CO2, diode, RF. So these are the options available to regain your vaginal lubrication. So starting with the regenerative therapies, that is what I told commonly as PRPs. PRP is nothing but platelet-rich plasma. PRP is used in different parts of the body because in our terms we call it as liquid gold. It has a potential of rejuvenating any area where it is injected. So basically what is PRP? PRP is platelet-rich plasma, means patient's own blood is drawn and a process of centrifugation is done and there is separation of platelets, which is the growth factors, and that platelets we concentrate, we separate and we inject into the vaginal canal at multiple areas. So once this platelets goes into that area, it increases the neurovascular supply of that particular area because of the platelet having that potential of growth factors. So this helps in increased blood supply, increased neural supply, thus rejuvenating that part of the vaginal part. So this PRP is actually done in sessions, that is monthly one session for around 3 sessions depending on the severity of that particular patient. So monthly one session, 3 sessions is what we recommend, and based on the outcome after 3 sessions we decide if further sessions are required or we can stop it there, and a maintenance therapy as and when required. So that was about regenerative therapy. Now coming to the lasers. So basically this is an external genitalia of a female. So what we do in lasers is, this is how a laser probe looks like. So this laser probe is connected to a laser machine. So once it's connected, we pass this laser probe, which is quite okay in diameter, not so big, not so painful. So we insert it into the vaginal canal, and once it's placed in the vaginal canal, we shoot lasers at regular intervals with withdrawal technique. So once the whole vaginal canal is shot by lasers, one session is completed. So these lasers again comes with sessions, that is monthly one session, that is around 4 to 6 weeks gap we do one session. So as you progress, monthly once we do 3 sessions. So once the 3 sessions are done, we readdress the patient, we discuss the problems, what is her symptomatically better with complaints or she needs another 1 or 2 or 3 sittings. So based on our concerns, we go ahead with the sittings. So now coming to its safety and complications or benefits. So lasers, definitely this, whatever I've told till now is the benefits of laser. Now coming to the safety concerns and the things we need to be worried of. See, PRP and lasers both are safe procedures. PRP is patient's own blood, whereas lasers, we are not taking out any blood or anything. So PRP is also with less side effects. That is, other than if there is an active infection, usually there is no other problems associated with it. Coming to the lasers also is a quite safe procedures when done in the right hand. That is, we don't do these lasers without doing a pap smear and also without a clinical examination, making sure there is no infection or a white discharge which is excessive or an abnormal white discharge. So these are the primary criteria we need to follow. And once the laser is planned, it's actually a day care procedure. We don't need any anesthesia or any sedation required to do a laser. It's actually a safe procedure, painless procedure, and you also don't need any bystander along with it. We actually call it as a lunch break procedure. So once a laser session is planned, we make the patient lie down, clean that part area, and then we insert the laser and do the procedure. It takes around 10 to 15 minutes to finish the procedure. So post procedure, we usually tell to avoid intercourse or abstinence for around 3 days. So, and we also give you a ointment to be applied there, because if it's a CO2 laser, there will be small wound which is there in the vaginal canal, and even so for PRP, there will be small wounds. So we do give you an ointment which you are advised how to apply it post procedure. So now you know all these concerns are actually real, and it's not only you have to suffer. Don't take it as a stigma or a taboo. Kindly reach out to your gynecologist. We are there to help you.